Hi, it's Dr. Winbush with Sankofa Healing Arts and Functional Medicine, here to talk about another topic related to menopause. And so today I want to talk about a question I often get, which is why people often experience more blood sugar issues as they're entering and going through the menopausal transition. And what I mean by blood sugar issues is a whole spectrum of noticing, for instance, maybe that people are more sensitive to sweets and to carbohydrates, to being diagnosed with prediabetes or even diabetes. And so, what are some of the symptoms that you might experience as it relates to blood sugar issues? It could be that you crave more carbohydrates and more sweets. It could be that you feel tired after eating, especially if you have a high carbohydrate meal. It could be some weight gain around your middle. And again, insulin and blood sugar issues are not the only things that cause this, but they often are part of the picture. So, why does this happen, or why can it happen during menopause? Well, one of the reasons is that our estrogen levels are decreasing. And estrogen is a key hormone for many reasons, but one of the many things that it does is it actually helps sensitize us to insulin. So, as we have less estrogen around, our body is less insulin sensitive, which means that we require more insulin to be able to manage and balance our blood sugar. Because again, insulin is a very important hormone that helps our body to regulate our blood sugar issues. So, less estrogen, less insulin sensitivity. Another reason that we see this happening during menopause is that there's a lot of changes that are happening in terms of our body composition. The lower estrogen levels, as well as lower androgen levels. And androgens are kind of a family of hormones that include testosterone and DHEA. All of these levels diminishing can contribute to having less muscle mass. And we know that during this period of life, it's very common to start to lose muscle mass. And so when we have less muscle, we are less insulin sensitive. And a third reason is sleep disruption. So, sleep impacts us in so many ways, but the things we're going to hone in on right here are that number one, during menopause, people often will have disruptions in sleep quality. You may have some night sweats and some hot flashes that wake you up and disturb your sleep at night. And so that is a stressor, and that stress can lead to increased levels of things like cortisol, which in and of themselves can increase your blood sugar level. And we also just know that insufficient sleep is another reason that people will often crave more carbohydrates and also become more insulin resistant in general. So there's lots of sort of interwoven, overlapping reasons why disturbed sleep can contribute to both high stress levels and increased blood sugars. So that's just a really brief overview of some of the contributing factors to blood sugar issues during menopause. But more importantly, now that we have that understanding, what can we do about it? Well, actually, I'll back up one second. It can also be helpful sometimes to gather some more data. So you might have some of those symptoms that I mentioned on the other page, and you might be wondering, is this a blood sugar issue, or is this predominantly a blood sugar issue? It can be helpful to get some data, to get some testing. And so one of the tests you can do is to get just your blood sugar level checked, either by a finger prick or as part of routine blood work that's often done. There's a lot of limitations to that test because literally it's just telling you what your blood sugar is in that moment. It's not giving you any sense of a trend or any sense of how you're reacting to food. And for that reason, it's become much more common to look at blood sugar from some other uh, vantage points. One is something called a hemoglobin A1C, which gives us more of a sense. It's not a perfect test, but it gives us more of a sense of what your blood sugars have been doing over the past 3 months. Another test that can be done is to actually look at your insulin level, to look at your insulin level first thing in the morning when you're fasting. And we know that if we find that that level is consistently elevated, that can suggest that you're starting to develop some insulin resistance. It's also become increasingly common to use something called a continuous glucose monitor, which is a device that you wear that's relatively painless, but gives a readout of what your blood sugar does over a 24-hour period. And you actually will wear a continuous glucose monitor for a couple of weeks. And so something that can really give and shed a lot of light on what's happening with your blood sugar. And that's something that I will often help patients to interpret and support them in using. And then finally, you can also look to see what your hormone levels are as it relates to things like estrogen and testosterone to give another part of the picture. So once you have the data, once you have that information, once you've looked at your symptoms, what can you do to improve insulin sensitivity and to improve blood sugar handling? Well, we talked about muscle mass and how that diminishes. So, to combat that, it's very helpful to bring in some strength training and some resistance training, even if that's something you haven't really done before in the past. It's going to help your body to use the glucose in the foods that you eat much better and to stabilize that blood sugar. You also want to make sure that you've got adequate protein intake. And what adequate is can vary a bit from person to person based on activity levels, based on other factors related to your health. But you want to make sure that you're getting enough protein to have those building blocks to both build and maintain your muscle. Sleep. We already talked about how it can be problematic. You want to do what you can to support your sleep, to make sure that you have adequate time in bed, to get enough hours of sleep at night, and then to address those factors which may be disrupting your sleep at night. And then finally, hormone support can be helpful, especially if there are other indications, to manage hot flashes, to manage night sweats, which again will help support your sleep. And so, along all of these areas and these recommendations are things that can help stabilize your blood sugar. And if you need additional support, something that a functional medicine practitioner, an integrative health practitioner can offer you support around, both testing and with recommendations about how to address what you find on that testing. So I hope that's informative and is helpful. Feel free to ask some questions in the comments or to send me a message if you would like some additional information or to talk about working together.